let's welcome Melissa Bird, the Medicaid Director for the DC Department of Healthcare Finance. Welcome to WIN TV. Melissa, how are you?
I'm doing great this afternoon. Thanks, Denise. It's wonderful to see you today.
Great, thank you, thank you. I was, as we were saying before the show, I'm glad that you're here with us because I've been hearing a lot about, the job ahead of you, this information you've got to get out to DC residents, over 300,000 of them. And I said, what can we do to make sure that we help on our WIN TV platform? So if you could just tell us first a little bit about the services that your office or your department offers, and then we want to make sure that folks know what your message is today.
Great. Thanks, Denise. So the Department of Healthcare Finance is a district agency, and we administer the public health insurance program. So Medicaid, the Alliance Healthcare Program, and the Immigrant Children's Program. You folks who are on Medicaid may better recognize us through AmeriHealth Caritas DC or MedStar Family Choice or Care First. Those are our managed care plans. But through the Medicaid program and the Alliance program, we provide access to healthcare services. So like being able to get prescription drugs at no cost or going to see the doctor for no cost. If you need hospital services, maternal health services, well child visits, all those kinds of things are covered. Along with other services such as transportation to your doctor's visit, things like that. So just generally speaking, it's health insurance for district residents without cost sharing. So no cost. It gives you access to the care you need.
Wonderful. And the headline today is...
Don't wait to update your contact information. So what's changing now is one of the great things that we can do through the Medicaid program and did over the past 3 years is that when the COVID pandemic hit the nation and the district specifically, is we were able to stop doing something, stop asking people to renew their coverage every year. And the reason we did that is that we wanted to make sure, during a pandemic that folks did not lose coverage and access to really important COVID tests, treatment, anything else during that period of time. So across the nation, all Medicaid programs, we were able to stop doing that annual, come back in to us and check your eligibility. But that's about to end at the end of this month. So starting April 1st, we start renewing Medicaid eligibility again. And so what that means is that individuals will need to come check in on their Medicaid certification and make sure that they're giving us all the information so that we can confirm their eligibility. But first and foremost, going back to don't wait to update, things change over 3 years. Sometimes things change over a day. But if you've moved or changed your phone number information, it's really important that you let us know what your current address is, what your current phone number is, to make sure that we can get this important renewal information out to you to make sure you don't lose coverage if you're still eligible for the program. And you can do that by going to districtdirect.dc.gov. One of the great things that has happened during the pandemic for us is that we do have the ability for district residents to now access their benefits online. So you can go to districtdirect.dc.gov, you can download the app, or you can, if you still prefer and are used to calling us, you can call 202-727-5355 and update your address, your phone information, just that basic information so that when we start sending out notices, they get to the right place and your renewal packet can get to the right place as well.
That's interesting. Yeah, you raised a couple of questions for me. One is, you kind of implied it, you don't want residents to lose their coverage. And is that what happens if they don't recertify?
Sure, exactly. So if you do not recertify your coverage, then yes, you are at risk of losing your coverage. One of the things that we can do is that a number of folks in the Medicaid program actually won't have to do anything. We have a new renewal process called passive renewal, which means through our system, we can touch base with a bunch of other systems to get the information we need to renew someone's eligibility. And that individual has to do nothing. And they'll know if that's their case because they'll receive a letter from us that says, congratulations, or great news, your coverage is renewed and you have it for the next year. For folks where we can't do that, you'll get the renewal packet in the mail. You will receive it either 60 or 90 days before your coverage ends. And then 30 days before your coverage ends, we'll give you another notice to say this is about to happen. And so we ask folks, as soon as you get that mail, or even if you're unsure of when your coverage may end, reach out to District Direct, call us and confirm that end date and respond as soon as possible to make sure you don't have any interruption in your coverage.
The one thing I don't want to say, because there's a sense of urgency here, I understand, but you've got time to do this.
Yes.
But so, I mean, weigh that for us, why people should do it now and not wait.
Sure. I think the best reason for folks to not wait to update is just to make sure we do have that contact information. Obviously, we can't tell you what you need to know if we can't reach you. And so if we have that information now, whether you'll receive a notice from us in a couple weeks or 6 months from now, just depending on when your eligibility may end, at least you have the confidence to know it's going to get to the right place.
And I was also happy to hear, as we talked before we went on the air, all the partners that are working with you, the school system. I guess there are others that are working with you to make sure that this message gets out.
Exactly. We're working with all of our key stakeholders. So, of course, our other district agencies. And like if you need some assistance filling up out your application and you're a senior in the district, you can go to a senior wellness center. Our providers, of course. So if you're going to the clinic to see your doctor for your annual checkup or your kid's well child visit, they should have some information and can tell you as well. And then, of course, working with our partners such as DC Public Schools in order to get the word out. So we're really trying to meet people where they are and get information to where they are. And then in addition to that, folks will start seeing bus ads. We'll be doing robocalls and text messaging to Medicaid beneficiaries to say, hey, don't wait, update your information, and then wait for something from DHCF in the mail.
And we're talking about close to 300,000 people that you're trying to reach to get recertified?
Yes, we have about 300,000 district residents on our Medicaid program today. That's about 50,000 more people than when we started back in March 2020 with the pandemic. So it's not 300,000 different households. Obviously some folks have multiple family members in a house that may be on the program, but still it's a significant number of individuals.
Yeah, quick question, and people that know would know, but what qualifies you to get Medicaid?
Sure. There's a few different ways that you can qualify for Medicaid. And the most common or probably best known is through your income. So most district residents, if you are at about $30,000 for income over the year or less, you're likely eligible for the program. Mm-hmm. And then some folks are eligible for the program because of their age or a disability. And so it's a combination of those couple different things.
And what about citizenship? Is that a requirement?
For the Medicaid program, citizenship is a requirement. Medicaid is a federal government, state government jointly run program, and that is certainly one of the requirements. However, in the district, we do have the Alliance and Immigrant Children's programs where you must be a district resident, but you do not have to be a lawfully abiding citizen of the United States.
Okay. All right. Well, this is good, Melissa. I mean, every day we wish we could reach 300,000 people with the Washington Informer. So I'm going to have to call you to find out how to do it. But we want to do our part, at least to help. We know that we can hit some of those folks that need to know this information. And we're really trying to do our part to make sure that your job is easier to get all the check marks off, to say, job well done. We got at least close to that number. And I'm assuming that you're want to get them all.
We want to get everyone who is eligible. We want them enrolled in the program.
Mm-hmm.
It's a great benefit to folks. Healthcare is extraordinarily important, which I think everyone knows. It's been, obviously greater importance we've seen over the past 2 or 3 years with the COVID pandemic. But yes, our goal is that if you meet our eligibility requirements, we'd like you to be enrolled in the program and getting the healthcare that you need.
Wonderful. Well, thank you so very much for coming on the show today. We may bring you back, particularly at those key times of the year when people are like, back to school time, which we talked about earlier, what have you, so that we can continue to help to get this message out. But, you can count on us to do that. All right. You have a great one.
You do the same. Thank you so much, Denise.
Surely. All righty. We're going to move now. And please, if you heard this message and you know somebody that is on Medicaid or is eligible, please make sure you share this information with them. And then not only share it, but then check back with them and say, did you recertify? It's important that they do this. So, each one bring one, each one recertify one, each one can do something to make sure that no one in our community is caught off guard and unable to get the medical coverage that they need from this program that provides free medical services for those who can't afford or within a certain income bracket. And that includes a lot of children as well as a lot of seniors. So we want to make sure that everybody gets recertified.